So I have another question I'm really interested in. Your work on the coronavirus prevention was all over the media. Even President Obama retweeted an article where your statements were in there. Please give us some background.
Oh, so this was something that happened, like many people, obviously, we've been really struggling with how do we deal with the horrible effects of the coronavirus. And because I have joint appointments at the Hong Kong University of Science and Technology and at Berkeley, I see, very regularly what's going on both in the East and the West. And by February, it was really alarming me that Hong Kong was paying attention to the WHO warnings and the warnings from China, and it was already locking down. In January already, uh, there was immense amounts of planning for what happens on February 1st when the semester was supposed to begin. Should we not physically open up? And indeed, we never opened up physically. We converted to all online teaching the entire semester. Uh, and by mid-February, it was really alarming to me that not only was that discussion not really happening seriously in the West, in the US or in Europe, but even face mask wearing was not being discussed. Hong Kong already, literally 99% of the population masked up. I could not go into town not wearing a mask without hearing about it and getting dirty looks, and because uh, you're not doing your part to prevent spreading your possible COVID viruses to other people around you. It was not just about protecting yourself. It was about protecting those around you, the community around you. But when you looked at the WHO data, when you looked at, other data sets, Johns Hopkins or whatever, even though they were listing which countries had social distancing and which countries had testing and contact tracing, they didn't even bother listing which countries had masking. And this was alarming to me because masking costs far less than testing and tracing and many other measures. There is no more evidence for social distancing than there is for masking. And and so we formed a team rapidly in late February with not only me at Hong Kong at Berkeley, but also with London uh, and Paris and Helsinki and Estonia, Tallinn, uh, to across disciplines, from everything from medical doctor in London on the front lines of treating COVID, to economist in Paris, to um, uh, someone who's actually in senior advisor to the ministry in Finland, looking at public policy, uh, and a computational biologist uh, out of Cambridge. And so we really looking broadly at this. We built two new theoretical models. I built an AI inspired model uh, that was combining agent-based modeling from the long tradition in AI of you have intelligent agents walking about and interacting when they meet each other, uh, to do the predictive modeling. And I made it highly visual so that you could actually see these agents walking around. You could just take your browser and go straight there and play with it yourself if you like, and you can set your own assumptions about how many people are infected and how many people there are and how effective your masks are at blocking transmission of viruses versus blocking absorption from other people into your system when you inhale, and and you can see what happens. And so I made this 4-minute video to explain as a tutorial how to use that. um, the video got a huge amount of interest, uh, and led to a quote cover story on Vanity Fair uh, that really raised a lot of awareness amongst European and North American states. And basically, we found that if you need 80 or 90% of the population to wear face masks. and you need them to do it fast before the virus spreads to too much of the population. If only half the population wears masks, it has almost zero impact. And the reason the visual simulation is so good is because that's counterintuitive for most people. Most people think if half the population are wearing masks, then it'll stop half the infections. And that's simply not true, it turns out, because of the exponential behavior of virus spread. Half the population wearing masks has almost zero effect. 80 to 90% is needed in order to have significant impact. And if you do that and you combine it with other sensible measures, social distancing, and you do need testing and tracing, then you can control the spread long enough for the scientists to develop the vaccines and the treatments and prevent the hospitals from getting overloaded. Otherwise, we create thousands of unnecessary deaths a day. And so that project was a really cool application of various concepts from AI and computer science to tackle the social problem right now that is urgent upon us, that we're still grappling with, of how to save as many lives as possible, how to be able to exit from extreme lockdowns without risking lives in an excessive way. In Hong Kong, because we put on masks really early, we have never had to have a strict lockdown. The restaurants have never been closed. We can go out and shop. We do sensible social distancing, and we wear masks, and we have not had to. And to this day, we have had a grand total of 4 deaths. You're talking about a place with a population of 7.5 million, approximately New York City. And so, and in total, we've only had a couple of hundred local transmission cases. Almost all of our cases came from imported cases from people coming back from Europe or the US or other places, imported, who got, tested and quarantined. And so, I think there are a lot of things we're talking about AI ethics, right? There are a lot of things that we can do with AI to really have a positive impact on society as a whole. And that's an excellent example.
Okay. Okay, thank you. That's very interesting. And there's a website up where you can look
Absolutely.
at
Yes.
what's
Go. The best place to start is that explainer video. It's only 4 minutes long. And you can find it easily at dek.ai. That's my
okay.
name with a
Yes.
dot in it.
Yeah.
/mask video. So dek.ai/mask video.
Okay. All right. And I'll also put it into the show notes so people can
Super.
check it
Yeah.
out.
In the video description, there are links to the rest of it. There's a website with all the resources. It's
Okay.
dek.ai/masks for all. Number 4. There's a white paper that is highly visual and easy to read. There's a research paper. There are a number of other related videos.
Okay.
List of news stories.